Hi everybody. Right, as promised, we're back here again 2 weeks later. So hopefully tonight I have a Dr. Jones joining me. Now he's going to talk about a research kind of project associated with corona, one that he's been advocating to patients. So just a little bit of introduction to him. I'm hoping he'll be able to join in a minute. I'm waiting for my producers to give me a nod to make sure that he's on screen. No, I'm getting lots of shaking of heads at the moment. So bear with us when we get him on to join with us this evening, but he will be talking about that. And when he gets on, I'll do another introduction for you all that hopefully will be sound, and you can just wait a few moments for him. So while we're waiting for Dr. Jones, what I'm just going to do is recap on what we've done, well, what's happening now. So we ran another clinic last Friday just gone, and had a lot of patients from cohort 6 and also cohort 5 and a few from cohort 7. And I'll just go through what that actually means and what happens for you next. So as you know from our last discussion, we were concentrating on cohort 6. That's what the government wanted us to do. That was for people aged 16 to 64 who were are carers, are considered moderately at risk and have underlying health conditions. We have a vast number of those patients, and indeed I'm pleased to tell you that we only have 283 currently who have not been vaccinated yet. Now we have invited all the people in that group that we're aware of, and there are still 283 who haven't come forward to us to be vaccinated, but we have been in touch with them. So going on from that, in terms of moving that forward, because we had those gaps, we were able to invite those people that were in cohort 5, as promised from last time. So that were people that were aged 65 to 69 to come and get vaccinated with us as well on Friday. We also indeed had a few people in cohort 7 who are aged 60 to 64 who were invited as well for our numbers to make sure that we optimised our vaccine, and also indeed a few from cohort 8 who are aged 55 to 59. Now, the government has been sending letters out to patients aged 65 to 69, so that's cohort 5, those people who are aged 60 to 64 in cohort 7, and this week, those people in cohort 8, aka those people aged 55 to 59, should also receive letters from the government advising you to be vaccinated. We now know that that letter definitely says that you can go to a vaccination centre or you can wait to hear from your GP surgery. So our offer to you currently is that we are running another clinic for the vaccine programme on the 19th of March, and we will be inviting those people again from cohort 5 and cohort 6, so those people who are aged 65 and 69, and those people who are aged 16 to 64 with an underlying health condition who are considered at moderate risk of coronavirus, and carers. That will be on Tuesday to book those appointments. On Wednesday, we'll go out and invite those people who are in cohort 7, so those people that are aged 60 to 64 that we're aware that haven't had a vaccine yet. And then on Thursday, we'll come out and invite those people who are aged 55 to 59 who are in cohort 8. So if you do want your vaccine with us, please respond to our invitations and book those appointments. For those people who do not have have not given text messaging consent to contact you, we will be phoning you over the weekend. Okay, so those people that we can't get hold of, we will be phoning you over the weekend to book those appointments. And if we have any left after that, then we will be moving on to our next cohort, which are people who are aged 50 to 54. And we do know there are 839 of you out there in that group. So of course you won't all be able to be vaccinated and take up that opportunity because we will run out of appointments, but we will be inviting you to be able to come and book if you want to have that appointment. Now, we're not aware of when our next vaccine delivery is after that, but as soon as we know, as we always do, we tell you and tell you when the next appointments are. So that's what we've got so far. So rather than do anything else, I'm now going to pass you over to Dr. Jones. You can now have a think about what I've just said, listen to Dr. Jones, and then I'll have a look through the questions and hopefully be able to do some answering and be able to get back in touch with you. So I'm going to hand over to Dr. Jones. He was a consultant at Salisbury Hospital for over 30 years. He retired in December and has been working with us on the vaccine programme. So I'm going to pass him over for you to you now to have a chat about his research project that he's been promoting. So over to you, Tony, Dr. Jones.
Thank you very much, Anna. Yes, as Anna says, I'm a recently retired consultant cardiologist and now part-time vaccinator with an interest in the sort of scientific aspects of finding out a bit more about infection and vaccination. And I'm very grateful to the Salisbury Plain PCN group for allowing me the opportunity to try and encourage you to consider joining in with the COVID symptoms study. I don't know whether you have heard anything about this at all. There are 4.6 million regular contributors to it, but it would of course be even better if there were 70 million contributors to it. So we're encouraging everybody to join. This is an academic enterprise entirely for scientific purposes. So let me get out of the way, first of all, why you shouldn't do it. Some people think it's a bit of a nuisance to have to log on and enter detail into the app, but I can assure you it takes a very, very short time indeed, less than a minute each day. Other people are concerned about the security of their data, very reasonable concern. But in this case, well, I'm not an expert on internet security. There is a lot, if you log on to the app, in the frequently asked questions about the data security policies. But I can tell you that I am entirely confident that there is no commercial or political aim associated with this study, that the data is entirely anonymized and used purely for scientific purposes to answer really important questions about how we control the infection and which vaccines are working and how they're working and what the best combinations will be. So I'm entirely comfortable about entering my data into it and would certainly encourage everyone else to do so, because already a number of quite important questions have been answered. If we could turn to slide 2. Stuart, thank you. Already data entered by what we might call citizen scientists who enter their data into this app, it has been used for early identification of new outbreaks of infection, because a large number of people are entering their data all the time. If there is a cluster in one area, then it can be identified by the app more quickly than by any other source of information, because we now know that the diagnosis can be made quite reliably by a combination of symptoms, and this app has the power of large numbers to identify when new cases are being identified. It was the COVID app, symptom study app, that identified what are now regarded as cardinal symptoms of the condition, loss of taste and smell. That information first came because a lot of people were entering data about how they felt when they got the infection, and it became clear from the app that taste and smell was a common and really quite discriminatory symptom of the condition. It has allowed us to identify which particular communities are at higher risk of infection. You will know that Black and ethnic minority groups have particular risk, not only of catching the infection, but of having more serious infections too. And that information has been made clear has arisen from analysis of information in the app. It's been used to identify the value of swab testing in the control of spread of infection and other tools used to control the spread of infections become quite clear from information entered into the app. It started as a symptom study, and so people are asked to enter a great deal of detail about what particular symptoms they've had. And as a large number of people have entered their symptoms, it has become clear that you can create a formula for the risk associated with particular sets of symptoms. This allows us, has allowed us, to identify people who are at particularly high risk of developing serious illness by their nature, the conglomeration of symptoms with which they present, and that there are other things such as the impact of smoking on COVID risk and so on, which has become clear from the data emerging. However, we're now in the next stage where people are beginning to be vaccinated. And so can I have the third slide, please? It is really particularly important that we do recruit people who are being vaccinated, because there are still a number of unanswered questions about vaccination. You will know that all of the vaccinations are very effective and they are very safe, and that's been tremendously good news for everybody. But there are still unanswered questions. You will know that there was quite a row at governmental and national scientific level about whether it was safe to delay the second dose of vaccination. When the clinical trials were undertaken, there was a very specific protocol, and the second dose was given at a particular interval. But a number of people thought that it might be safer for the country as a whole to vaccinate more people more quickly with their first injection and delay the second injection as a necessary consequence of that. It now appears that that might be actually rather better than using sticking rigidly to the protocol that was in the clinical trial. And it will be very important to get more information about the ideal timing of second dose administration, and also to look at which vaccines perform best in the real world situation. We can't always extrapolate from clinical trial information directly to what will happen in the real world, and it's terribly important to have what we call registry data, lots of people who've been vaccinated logging their experience after the vaccination, in order to find out what happens in the real world rather than just in the clinical trial. It's certainly going to be important. This will provide important information about which vaccines are most effective, what timing of vaccination administration is most effective, and to see also what really importantly the effect of vaccines on not only spread of infection but serious consequences of infection. So may I encourage you, if you are being vaccinated, to consider taking the relatively simple step of logging on to the covid.joinzoe.com address and downloading the app and entering your symptoms and experience of vaccination regularly in order to help with this, in my view, very important national scientific study. Thank you. So over to you, Anna.
Sorry about that. I had myself on mute while I was listening to Dr. Jones. So I was just saying, whilst mute, that to say thank you very much to Dr. Jones for joining us. I hope that you've all found that really useful. It's slightly different to our normal chats that we've had over the recent weeks, but I think it's really relevant and really important. So we all urge you from our PCN, that's Avon Valley Practice, and Sarum Health Group, to take up this research study, and share your information so that we can learn more and more about coronavirus and how we can work together to get out of this pandemic. So whilst Dr. Jones has been talking, I've been reviewing your questions to be able to do that. So the most important thing that's come up from the questions has been about your second vaccine date. And as I said last time, that I would go away and talk more with NHS England because of the lack of information that we've had about when the next lot of vaccine for second dosing will arrive, because our predicament is about Easter. So those people who were booked for the 16th and 17th of January who had their vaccine, okay, at that period of time, we were told that you were going to be revaccinated at 10 weeks. Okay, so we told you all that that was going to be the 27th and 28th of March. Now, the world has changed since then, and they have moved that revaccination date to 11 weeks. Now for us, that means that it's Easter Saturday and Easter Sunday. Now I've raised my concerns consistently with NHS England about this date, because of course it poses numerous issues for all of us. Vastly all different, but they do cause issues. Now I have been told that they think, and let's be clear on this, they think that at the moment they will be delivering that vaccine slightly earlier to us that week. So that week of the 29th of March, they will be delivering it at some point in those first few days. However, they cannot tell me whether it will be the Monday, Tuesday, Wednesday or Thursday. They just know that it won't be on Good Friday. And that's what happened last time. So if you count back 11 weeks, it arrived on Friday the 15th of January for us to be able to vaccinate you on the 16th and 17th. And remember, this is crucial because the Pfizer vaccine must be used within 120 hours of arriving on site with us. So we have a very short time frame to have you in and vaccinated. So as soon as we know which day of the week that vaccine's coming, we'll be able to book your appointment for you. Now, NHS England has advised that we do not book this for you as yet, because the likelihood is if we punt for a date, it'll be the wrong date. And with over 1,000 of you coming, we do not have capacity to cancel all your appointments. Okay, we need to focus our energy and our workforce on getting you the first appointment right the first time. So for your second vaccine, it will be at some point in the week of the 29th of March. So that's the week of the 29th of March at some point. But I'm so sorry, I don't know when that is. As soon as I know, I will let you know. Okay. Also, we will be going out by letter to invite you into your appointment time again. All right. So that is what our commitment to you. We will be sending you a letter to book your appointment so that you may attend at that appropriate time. OK, now, if you were vaccinated the following weekend, so that's the 22nd and 23rd of January, your revaccination dates are currently thought to be the 9th and 10th of April. However, Easter gets in the way again because we've got Easter Monday. So at the moment, they can't again confirm that whether there will be a delay in delivery across the nation in terms of being able to get that vaccine to us for the 9th and 10th. So we just have to be a little bit more patient. They've said that they hope to tell us the week of the 22nd of March what will be happening the following week. So I know it's short notice. I understand that. And it's really tricky because I also understand that, of course, it's part one of the roadmap from Boris Johnson telling us how we can get out and how we can meet other people. And yet you're still waiting for your second vaccine. But I do promise that as soon as I know, I will tell you. But there is no point in booking or penciling in an appointment that is likely that it isn't going to be the right date or time, because we have to use our workforce safely. We have to make sure that you know what time you need to come, and we'd rather get it right first time than kind of estimate, get it wrong, and then you may turn up and find that actually we changed it and we just couldn't get hold of you. And I really don't want to upset you in that way. So I understand it's frustrating. It's frustrating for us too, but we are doing all we can to try and get those dates. So as soon as we know, we will let you know. I promise. OK, so let's have a look at some questions and see if there's any for Dr. Jones at the moment about the research project. So let me have a look. So there aren't any questions for Dr. Jones at the moment, so please do ask any. Please post them online if you've got them, because I have him waiting to be able to do that. OK. Now, there's lots of the questions in terms of saying thank you for your vaccinations, which is brilliant, and it was a safe and positive experience. So that's really good to hear. To be able to do that. We've got people asking again about how we will contact you. So we try and do text messages for our people who are in cohorts 5, 6, 7, 8 and 9. You know who you are. We go through those groups. However, the second vaccine for those people in groups 1 to 4, so the people aged over 70, will be getting letters to book those appointments exactly as we did before. OK, to be able to do that. And somebody else has also asked, I've heard they are decreasing gap between jabs for ones who have had Pfizer. Is this true? Thank you. Now, I think that might be where there's been some information in the press, and I'm just going to make sure that with Dr. Jones I've answered this right. So Dr. Jones, tell me if I'm doing this wrong, and we can pass over to you. There are some circumstances whereby the 11-week gap is being reduced, both for Pfizer and for AZ, for patients with particular clinical needs. So the gap is reducing if it's appropriate for the care and treatment that patient is ongoing. So there are cases, patients who have been diagnosed with cancer and require treatments and etc., and they're being advised to get their second vaccine sooner than the 11 weeks. I'm just looking at Dr. Jones to see if he's going to nod with me. Yeah, he's smiling. So I've done the right thing there. And we also know those people that have had a kidney transplant are looking to have a second vaccine much sooner as well. OK, now we follow the guidance for those, and we actively engage you to come in for your second vaccine because it is outside of the routine. However, they are exceptional cases. It's not the routine and normal regular recall that we are being asked to engage with across the nation. OK, let me keep looking at this. So when will we be, so the last question here says, sorry if I've missed this, had technology issues. When will you be vaccinating 50 to 55-year-olds? So if I can just recap on that then, in terms of what we talked about at the beginning. So we have vaccinated all of our patients in cohorts 1 to 4 who are able to have the vaccine at the current time. Anybody who comes into that group, so those people all aged over 70 or clinically extremely vulnerable, are vaccinated as soon as we can get them vaccinated. And that may be at a vaccination centre, that may be with us. It's who's ever got the vaccine available first for you. Now, we then know that in cohort 5, so that's people who are aged 65 to 69, have been invited by the government. OK, indeed, we have also gone out and invited you as well, following on from our conversation 2 weeks ago, when we found out that actually been advised that you can also come to your GP surgery. And indeed, we have 59 patients left. We have contacted those 59 patients. They had not responded to join us in terms of in the clinic. So we're assuming that they've booked an appointment with a vaccination clinic or indeed are unable to have that vaccine at the current time. We will continue to re-invite you though, we don't lose you, OK? We then move into cohort 6, and that's people that are aged 16 to 64 who are carers or who are deemed moderately at risk of coronavirus. Now, we again have invited all of you to join us, but there are still 283 patients left in that group. Of course, for numerous reasons, but that's how many we have left. And we have been concentrating on this group in line with the government agenda. However, we did have some spare because people didn't all book the appointments. And so we did open up our vaccine clinics and appointments to those people in cohort 7 who are aged 60 to 64. OK, and also some of those people who were for aged 58 and 59 who are in cohort 8, so that we could use all the vaccine that we had on Friday of last week. Now, you can see that we've still got lots of people to go. So in terms of what we're doing next, we're holding our next clinic on the 19th of March. 19th of March, OK, in the afternoon. And we will be inviting tomorrow. We'll be sending invites out to those people who are in cohort 5 and cohort 6 again. OK, so that's people aged 65 and 69, and those people who are aged 16 to 64 who are carers or who are moderately at risk. On Wednesday, we are going to invite those people who are aged 60 to 64. And on Thursday, we're going to invite those people who are aged 55 to 59. OK, in terms of that on Thursday. We'll then see where we're up to on Friday evening, and on Saturday and Sunday we will telephone those patients to see whether we can very much encourage you to join and book an appointment. Any appointments left next week, so next Monday, we will be coming out to the patients who are aged 50 to 54, that's cohort 9, to come in and book an appointment with us on the Friday the 19th. And we're keeping that order nice and quickly so that you know when our appointments are, 19th of March, and that you're being invited. And we're doing that to make sure that everybody in priority order is invited in the correct order so that they get the first chance of getting that vaccine. OK, but we do know that we have gone out to cohort 5 and we've gone out to cohort 6 on numerous occasions. OK, so we are expecting to be able to vaccinate all of our cohort 7 patients aged 60 to 64, and those people who are aged 55 to 59 at the close of play on the 19th of March. If we have anything left, we will come to those people who are aged 50 to 55, or 54, should I say, to book an appointment for the 19th of March. Now, we do know from the government that they have sent letters to patients who are aged 65 to 69, those patients who are aged 60 to 64, and those patients this week who are aged 50 to 59. And the 50 to 59-year-olds are being invited this week. So the letters should be going out to you as we speak. They contacted us on Saturday to inform us of that, but we do know that that letter said you can book at a vaccination clinic or you can come to your GP surgery. And just to reassure you, we have appointments and we will be coming out to offer you an appointment for the 19th of March. OK, so I hope that that's kind of explained what we're doing again to make sure that you know the plan. Now I'm just going to check my questions again to see what we've got. Right, OK, we've got a question for you, Dr. Jones. So it says not a question, but I'll still ask you. I've been logging onto the Zoe app since April last year and found the information very helpful. Thank you, Dr. Jones. So, Dr. Jones, have you got any other examples whereby people have found it easy? How long it perhaps takes to put this information in?
Well, I've been logging myself every day for a year, and I must say I don't think it's been very difficult or take very much time. Mostly you log on and say nothing has changed, and that takes literally seconds. When you have a vaccination, you have to put the detail of the vaccination in. That takes a little longer, the serial number and so on. When you've had a test, you put the details of the test and the result of the test. That takes a little longer. If you develop any symptoms of any sort, you put them in, regardless of whether you think they are part of a COVID infection. That takes a little longer, but never more than a matter of minutes in the morning. You won't forget because every time you log onto your computer each day that you will have had a reminder, and it's very easy to do quickly. But your questioner did raise one very important point, which I sadly missed from my presentation, and that is to point out the rich wealth of detail that the app provides for you about the information that has been produced, about other scientific work that has been published in the area, and gives you access to a weekly presentation by Professor Tim Spector on what's new, what's important, what's happening in COVID infection and the treatment of COVID infection. I must say I've found that absolutely intriguing on a weekly basis, and I certainly think that is a great benefit, not just in terms of the scientific endeavour, but for individual patients to have access to that information as it comes off the press. I should say over to you, Anna.
I've done that again. I put myself on mute. See, it's because I'm so used to being the only presenter, aren't I? I'm forgetting myself. OK, so we've got another question here from somebody, Dr. Jones, and it says, if you have no symptoms, is it still useful to join the survey? So we'll just wait. Sorry, 1 second. Just wait for you to. There we are.
Yeah. OK, no, it absolutely is. It's just as important if you have no symptoms as if you have symptoms. When we're trying to work out spreads of infection, it's very important to know not just the numerator, the number of people who do have the infection, but the denominator, the total number of people. So you know the proportion of infected individuals so that you can work out how the infection is spreading through the population. So absolutely, the answer to the question is an unequivocal yes. Back to you, Anna.
Thanks, Dr. Jones. So I'm just looking at some more questions in terms of that. Oh, somebody says, I've just signed up to Zoe. Brilliant, Dorothea. Brilliant. I'm just typing brilliant. Absolutely fantastic. Okay, so there are also some more questions here that are ongoing that are individual to each of you about particular treatments that you're on. So what I'm just going through is replying back to you to say, can you share your name and practice? And what I think the easiest thing to do is first to take that back to your registered practice and ask them to contact you to review what the best case is, okay, for your treatments. So I'm just kind of going back to you saying, please can you share your name and your GP practice? Bear with us, it may take us to the end of the week, but we haven't got any more vaccine until the 19th of March, so you know that you won't miss out, and we'll come back to you to just clarify what is needed on an individual basis to be able to do that. And let's just have a look. And somebody else has said, and will you be able to get this uploaded onto YouTube straight away? Well, I'm just going to ask my producer Stuart, and he's just put a big thumbs up to me. So absolutely, this evening we will put this onto YouTube for you all to see. Now, just before I go, because it is 6 o'clock, I have to say it is lovely to meet so many of you during these vaccine clinics. It is an absolute joy, and I think probably a lot of you will notice that I talk to you as if like we've known each other for years, because I do think that since we started this in mid-November, you've shared so much with me. I understand more. You tell me what's happening when I don't know, and I'm very, very grateful for that. And I hope that again you find this useful. I do really appreciate your time, and I am looking at other things to make this even more interactive. Rather than just on text, Q&As of having to type it, because I found a system called Menti, and if I ask a particular question, actually, and you answer it, it can give me a live graph that we can all see. And I think that's it made me think of this last time when we were talking about people who were aged 65 to 69 and who wanted a vaccine at our site in Lark Hill, as opposed to going to the vaccination clinic, so I could get an understanding of the numbers in comparison to those of you who have logged in, and that would have been really good for us all to have seen. So I am investigating that a bit further. It will take us a little bit of time to get used to how it works and what we do. And already Stuart is pulling his hair out with me, thinking, Anna, you've got another idea. But it's good to keep this fluid. It's good to keep learning. And I do really appreciate your efforts to join us each time that we reach out to you and run these events. So on a last note, thank you to Dr. Jones for joining us. Really good, very much appreciated. And of course, you may well see him. He may well vaccinate you in a few weeks' time. So take care. Have a good evening. The sun is shining still, just about, before we get the thunder and rain on Wednesday. But enjoy, and we'll see you soon. Take care. Bye.